I believe my screen is visible. So I just wanted to give you an overview of what is medical billing. So why it is needed, so how it works and what all the scope it's been involved. So medical billing, it's nothing but it was a process that involved between the patient, hospital, physician, in the sense it's a doctor, and the insurance. So these four are the major vital roles plays for medical plays in the medical billing. Patient, you know that whenever the patient has any issues in regards to that disease or any regards to this health issue, so we will consider them as a patient. And hospital, you knows it very well that, so whenever we are going through any medical conditions or medical ill, so our first point of contact will be approaching the hospital. So after approaching the hospital, definitely we have to meet the physician. So here, how it works in India. So we will be paying from our pocket. Most of the citizens are not holding insurance here, but US, it is not like that. 80% of the citizens are holding the insurance because they are focused on their health. They are very keen on their health issues. So whenever they are having any minor or major complications, so they will visit the doctor for sure. They will not prolong anything. They will not take it so easily when it comes to any disease or any medical ill. So that is the reason their insurance is very effective in the US market. So let me give you another overview. So here how it happens in India. So if you're feeling well, if you are not feeling well, for example, if you're having a cold or fever, so we will be going to the doctors, like clinic, whatever it is. So if it is an hospital is approachable, you can reach the hospital. If it is a clinical approachable, you will reach the clinical. So after meeting the provide doctors, and you will be explaining what are the complications you've gone through it, and based on the complication, the doctor will prescribe you in regards to the medicine or injection, whatever it is needed for your conditions. So the doctor will be giving you, and you will be paying doctor. So then and the service would have been completed. So after you paying, the relations between the provider and the patient, it's been done. So in US market, it is not like that. Even it is a inpatient or outpatient, they will be having a insurance. So here, medical billing is the process that we have to work for the providers, and we have to get the reimburse in the sense payment from the insurance to the provider. So we will work for it, and I'll let you know what all the scopes have been involved into this process and how does it works. And medical billing, it's nothing but processing the claims. As I mentioned that we are just working for the providers, and we will ensure that what are the treatment has been done for the particular date of service and where it's been done. And so what all that procedures have been done for the particular day for the particular procedure. So those all the information will be submitted to the insurance. So insurance will be verifying all the information, and they will be providing the payment according to the condition what as the service has been provided. For example, if any service it's not relevant to that, for example, if patient condition is for a patient met the doctor for fever, but the patient has the provider has not performed the service in regards to the fever. So for example, the doctor has given only the prescription for the cold, so the fever service was not been observed. So their insurance will not pay for that particular service, so it will be rejected, it will be denied. So that we will follow that with the insurance. We will verify the medical records and what is the condition, why the patient has seen the doctor. If anything missed out from our end, so we will give you the conclusion that we didn't bill the insurance appropriately. So these all the which is involved into the processing the claims. Okay. So CPT. So CPT, in the sense, it's a current procedural terminology. Okay, current procedure terminology in the sense. So here we would say, if we are going for a fever, then doctor will give you the antibiotic. Antibiotic is in the sense they will be providing a paracetamol, and they will be providing a IP injection. So that we would say that the prescription will be given to the pharmacy, and they will be providing it. So how the claims will be generated to the insurance? There is a different types of there are two types of codes that will be provided by the medical coders. And you know that in the RCM process, medical coding also been involved. So the procedure code, whatever the treatment done, that will not be explained to the insurance. So those explanation have been converted into 5-digit codes. So since we are only in the demographic, I'll be covering the overview. In depth, we will be seeing in the upcoming classes. So CPT will be described into the codes. Codes in the sense it will be a 5-digit codes. So it's been described that so on so code. For example, 00012. It is like a kind of surgery for this code. So if it is a fever, they will be providing some certain codes for that. For example, 99203. So the consultation between the provider and patient, how many hours the consultation has been done. If it is increased more than the 25 minutes, then the code will be changed and the amount will be changed, because money is value. Sorry, time is money. So time, based on the time, how many hours the provider is efficient with the patient, based on the hours the provider in the sense doctor will get the reimbursement. So CPT is the one will denotes what is the service has been performed during the visit. Diagnosis code, it is here I mentioned DX, it is a short form of DX. Actually it is a diagnosis code. Diagnosis in the sense it is a disease. So if you are coming for a fever, so the code will be given to it's been already designed by the American Medical Association for the CPTs, and diagnosis code it is for the WHO, World Health Organization. So the department is the one providing the diagnosis code. So what are the diseases? For example, if you are lacking of sleep, they will be providing one codes which is 3-digit alphanumeric with a 2-digit pointer. So it denotes precisely that what is the diagnosis code. So in the coding we could see two different books, that was like a telephone directory. So there is a two types of book being provided, one is for CPT and one is for diagnosis code. So the coding department is completely different. Okay, so there is a department which is more predominant in this medical billing, it's coding department. So once the coding has been done, there are several department which has been involved to get the payment from the insurance. So not only the coding it's done, apart from the coding there is a several department which is more needed for the medical billing. That I'll provide you insights in the next slide. So, what you say, if anything been outsourced from the US, the people used to call it is a business processing outsourcing. Absolutely not. When it comes to medical billing, it is a knowledge process outsourcing, because business processing outsourcing is in the sense when the entry level works also been outsourced. Okay, that's also been considered as a business processing outsourcing. But in terms of medical billing, so if you are not having a knowledge on learning how it works, how it operates, and what needs to be done and what not, so that is the reason it's been mentioned as a KPO, that is knowledge process outsourcing. Without knowledge, you cannot do anything. At least all the department has a minimal knowledge that is needed, basic minimal knowledge is needed to operate the scopes. I'll provide you that information. So why it's been outsourced? Why it was not been maintained in US? So there are three vital roles why it's been given to us. So especially when it comes to doctor, is geographical time. So when we are in a day, US it works on the night. Okay. So the doctor want to do the work on a same day. For example, the doctor will be seeing the patient in an 8 hours of shift. 8 hours in the same. If the shift is starting for the doctors around 9 a.m., then they will be finishing their shift by 5 p.m. Okay. During that time, Indian Standard Time will start our day. For example, if it is a 5 p.m. in US, it is a 8 a.m. in the Indian Standard Time in India. So what they will once they completed all the works, they will be scanning all the information to the Indian peoples. So whenever they are having contact with any organization, if they contact with US office, right? So they will be outsourcing all the info. They will be scanning all the information on a same day. They don't wait for the very next day. And one is the geographical time, as I mentioned that one is cost efficient in the sense. So when they are working with their citizenship, they have to pay in an hourly basis. It is a huge amount they will have to afford it. But when it comes to Indian standard, Indian market, so is a dollar value, right? How much dollar value? Today it's around 92 to 94. So $1, 1 penny is cost to 94 rupees for us. So that also one of the reason that it's been outsourced. So that's what you have to understand. It is not a BPO, it is a KPO. Okay, let me provide you that department which have been involved into this medical billing. Patient registration. Yeah, of course. How it operates in India when it comes to visiting a patient, visiting a doctor, it is completely different when you compare to US. So here you can go and see the doctor, you will avail the service, and you can pay forward and you will leave for the day. So very next day after your service, you will be leaving. But US, it won't happen until unless if it is an emergency service, you cannot meet the doctor directly. Okay, you have to get the appointment from the front office executive. For that, you need to approach that hospital, walk in, or else you can call and you can book the appointment. For booking the appointment, you have to give your basic information. Basic information means your your details in the sense what is your name and what is your first name, last name, and what is your phone number, what is your address, what is your email ID, and so what is your insurance you're having it, and what is your complication that you wanted to see the doctors. Okay, here they have another set of information. So after collecting all the information from the patient, the appointment will not be scheduled on a same day, on a same time. So they will do the due diligence process. Due diligence means they will be verifying that information whatever the patient has given in regards to the insurance. They will not be verifying the patient details like whether the patient has given you the precise information, whatever the information the patient has given, it is a correct or not. They won't do anything like that. So they will be only verifying that insurance whatever the patient has given. So here we do have an insurance, right? ICICI Lombard and Tata AIG. So like that, they have a certain insurance companies operating in US like UHC, Cigna, Medicare, so Aetna. So those all that insurance detail they will be providing it. And before go for the before booking that appointment, the doctor's team will verifying with the insurance whether the patient is active for the particular date of service. Particular date of service means so they will be verifying what is the eligibility date when the patient is enrolled to that insurance and is the patient is still active. And also they will be verifying is there any termination date is there. For example, if it is a annual plan, if the patient is availed the annual plan, obviously the patient knows it that when the term contract will be terminated, right? For example, if the patient is buying an insurance for today, if it is a 1 year plan, then obviously his policy will be terminated only during 17th of February of 2027. So those all the information they will be verifying. And since, as I said, during the registration, patient will be providing the complications, what all the complications they've gone through it. We would say it is like a clinical documentation. It is not a medical records, it's a clinical documentation. Based on the clinical documentation, what kind of service will be provided. For example, if we are saying doctor that doctor I'm sneezing for a longer time, I have a huge cold, I'm having a running nose, these all the complication when you are mentioning, and doctor knows that what kind of service he is going to provide to the to the patient. If it is a cold, right, they knows that it is a cold. So okay, patient having a running nose, patient having a sneezing problem, patient is having a dry cough. So when they knows that, they will be suggesting a treatment. So those treatment also they will be verifying according to the patient plan, those service will be covered or not. So if the service has been covered, obviously they are okay with that. Then what they will do, they will call and inform the patient, okay, we verified with your insurance, all are good. Okay, so when you want to schedule an appointment, so they will be checking with the patient free time. So patient, when the patient wanted to schedule an appointment, for example, if a patient want the doctor to meet tomorrow or day after tomorrow, then immediately if the slot is available, obviously they will schedule the patient according to the patient wish. If not, they will be informing patient, no, so there is no slot for today, tomorrow, and day after tomorrow. Then patient will be availing service based on the slot. So what are the slot is available? The patient will take the treatment. That is the process called scheduling. So we gone through it. What is patient registration? What is insurance verification? And what is scheduling? And treatment date of service. Treatment, you know that after scheduling the appointment, patient have to meet the doctor on the slot, on the scheduled time. So doctor will be verifying all his complications, and doctor will be giving you a prescription. So this is nothing but treatment, kind of treatment, you know it, what the doctor does it, right? Transcription. Transcription is the process that it's not now, it's been completely into AI technology now, but it is also one of the process, as I mentioned that during the geographical time, whenever that the US shift close, that doctors will be scanning all the information, and that Indian team will start working on their next day, right? So transcription process is involved into that. So what are the treatment during the treatment, the doctor will record all the session. For example, so they have a recording machine. So because it has to be documented, medical complications, if any prescription or any treatment was not suggested properly, it will into the big complications, right? The patient have provider have to face the consequences. So that time this is the proof that they will be giving to that cops. See the patient, what all the condition is said, based on this condition only I have given him the treatment. So for that documentation purpose, so they will record all the session. As of now they are doing it, but only one thing is now how the AI doing it, right? So during the conversation itself, AI is converting all the conversation into word document. Before it is how it is, so that recordings will be sent to the Indian team, and Indian team will be listening that conversation, and they will be typing manually, so each and all the words they will be documenting. That is called transcription. So medical coding, as I said, medical coding team is very much predominant. They need to code CPTs, they need to code diagnosis. They will be go through the paragraph, and what all the treatment has been done, and they will go through that what is the complications. For example, if the patient is having a stress or is having a shoot up in BP, that they would call as a hypertension. So hypertension, you know, that when the patient is out of tension, that obviously the BP, everything will be increased, right? So there is a code in for the diagnosis. It's I10. I10, it denotes that hypertension. Okay. So the medical coding department is the one, they will be suggesting what is the treatment and what is the procedure code and what is the diagnosis code and where the service have been rendered. So those all the information will be provided only by the coding team. So demographic and charge entry. So after getting all the patient information, okay, the patient registration information you received, insurance verification done, scheduling done, treatment done, transcription done, medical coding as code, give you the code. So we are maintaining a tool. Every billing office having a tool. Tool in the sense it's kind of software. Okay, so every billing company has a different software. So they have to upload all the patient information by keying this manually or electronically. They can do it. So they have to they have to maintain each one of the patient account into the system to ensure for the tracking purposes. Tracking purposes, they will track each and everything. So how many servers have been taken for how many servers the provider has seen for the particular month, and how many visit the doctor meets, and what is the revenue we generated for the particular month, how many claims have been paid on that month, and how many claims have been rejected by the insurance. To in order to track this information, every billing company has to maintain a software. Okay, in that software they will be updating all the patient information. As I mentioned, that coding team will be giving you the codes. That code will be entered by the charge entry team. So charge entry team, we used to say demographic and charge entry team, it is a kind of billing team. So they are the one will key all the information into the software, because that whatever the coding team is doing it, yeah, they are doing it in a PDF mode. And also now it's been automated, but not all the process have been automated. At least what to say, I would say 20 to 30 percentage companies are automated. So still 70 percentage are in a manual. So after updating the demographic and charge entry, so these information we have to send it to the insurance team. So only that insurance will process the reimbursement, the payment. Or else if that claims are not reaching to the insurance, they will not pay anything to the provider, right? So This is called EDI transmission. EDI is electronic data interchange. So whatever that information we have updated into our software, that will be transmitted to the insurance software, insurance company. Insurance company also having a different software. So what are the information we are updating here, that will be electronically transmitted to that insurance company. So insurance company will be verifying. For example, you know that what was our date of service format, sorry, date of birth format. Our date of birth format is DD, like date, month. It is DD in the sense 2-digit date and 2-digit month and 4-digit YY. It is a year. For example, if the user not keying that information appropriately, for example, the date of service, you know that most the patient date of service should be in the 19th century. If instead of 1957 or 1967, if someone is keyed like 1857, obviously it is impossible, right? The patient could not be a 200 years old patient, right? So those all that information will be rejected in the front end itself. They are giving you an alarming process that very next day you will be getting those kind of rejection if anything was not been done properly. Properly in the sense the format is anything is missed out. For example, if month you know that after 12 there is no such month like 13. If anybody is keyed like instead of date, if they have keyed that 14th is the date and month is 06 like June, and patient date of birth it's like 1997. Okay, it is June 6th 1997, not June 14th June 1967. Instead of month, if the patient is instead of date is 14, instead of date, if you are mistakenly keyed the month as a 14, obviously it will reject it, right? There is no such 14th month, right? Only that month ends with 12. So December our last month. So if the 14th has been updated in the month, obviously those will be rejected. So why this department is involved, right? So if there is no such department like EDI rejection, what does it will? It will reach the insurance and it will send it for a processing. That one of the appraiser will came to know that it was the date of service have been sent wrongly. Then again they will be sending to that billing company to inform that, see, the claims which you have submitted as a incorrect information of date of birth. So it will be taking nearly 14 to 15 days to identify this issue. When the software is implemented like EDI rejection is a department, it is auto run process. Very next day, whatever that mistake you have been done, that will be intimated to the billing office very next day. So very next day you can correct your mistake and you can send it for claims. So actually the claim processing time is 14 days. For within a 14 days the provider will get the payment from the insurance. If anything is not been identified in the in 1 or 2 days, obviously very after the 14 days only you will be able to correct your things. So after you have to send the claim back to the insurance, again they will get take another 14 days to process. It is a waste of time, right? So one rejection will may extend till 30 days for 30 days delays in the payment. So that is the reason EDI rejection been involved into this payment posting. So how we can identify these claims have been paid? So there is a team called payment posting. So they will balancing the accounts. For example, you know that when you are joining in a company, so you will be getting your salary, right? How it's been credited? It's been credited into your account, but still you will be getting your salary slip to ensure that what was your pay structure. So how many days you have been paid for the particular month. The same thing, the payment will be directly deposited into the patient, into the provider account, provider in the sense doctor account, but still you will be getting the explanation of benefits. Explanation of benefits, how many service it's been paid for, what are the service it's been paid, how much it's been paid. So we will be balancing those amount in the software. So if any payment, any patient does not receive the payment, that patient will be followed by the account receivable team. You can see it. So patient will be holding as two types of insurance. One is primary insurance and the secondary insurance. Because primary insurance will be paying and they will be having some contribution that needs to be taken care by the secondary. If the patient is not having secondary insurance, if we say that, we would say that it's a gap insurance. So what are the payment primary portion? Remaining balance would be taken care by the secondary. If the secondary insurance was not there, obviously it would be the patient responsibility. Patient have to afford from his pocket. So every maximum patient will be having primary and secondary insurance because they don't want to take care of this billing things. So once the primary portion is over, the team will be sending those claims to the secondary to ensure that what is the primary paid amount and what still you need to take care of it. What is the balance still you need to take care of it. So they will be sending those claims to the secondary. And the account receivable is a department who works closely in order to address the denial. As I mentioned that if any claims have not been covered, they will be providing the justification, description why it's not been paid. So for example, if they mistakenly stated that patient policy is not active for the date of service, for example, the patient has given the wrong insurance, so during the insurance verification it was not been done, obviously that claim will be denied because the patient has given the old policy. So what we do is we will call and verify the insurance why it's been denied, like patient not eligible. So we will be verifying the verifications team, verification system. If policy is not active for the date of service, for example, the patient whatever the insurance information what the patient has given, it is only effective till December 2025, which is ends on December 31st 2025, but the patient has taken a service on January 10 of 2026. Obviously, the policy is terminated before the service, right? So we in the insurance rep will be providing that no, the policy is terminated before the service. Then we will reaching the patient, and the patient will give us a valid information. Okay, I have given you the wrong information. That was a previous prior policy. Okay, let me provide you that updated policy. This is the policy which is active for this year. So these all that what all the claims have denied that will be taken care by the account receivable department. So these all the scopes which is been involved into the RCM cycles. Let me give you overview. So how it works. So when it comes to medical coding, they have a separate department. When it comes to demographic and payment posting, they would consider as a billing team. They in the day process in the daytime they will be operating. So they used to update the patient demographic charges as well as the payment. So account receivable team will be working only during our day night time, because you know that right geographical time. When we are in a night, US will be operating in the day. So when they are in day, we will be in a night. So whenever you are reaching that insurance rep, they will be available only during the daytime. So this account receivable team has to work in the night only. So as of now, so we were outsourced with medical coding team, demographic and payment, and account receivable. So these four scopes are having a huge opportunity in Indian market. Seriously, I would say account receivable team. I would have never seen that any of the people that they have been suffering like a having a job fear or job threat or not having an insecure on job. Nothing like that, because they're having a huge opportunity, as well as in the demo in the daytime. So demographic and payment posting, that we would say billing team also has a huge opportunity. When compared to AR, billing team is average percent, I would say 60 to 70% they will be having opportunity compared to AR, I'm saying. So coding, yeah, it is a huge opportunity. So you have to think, and you knows it very well how it works for you in terms of account receivable. Obviously you should have a good communication, then only it is a basic requirement for the account receivable. But still you feel that I'm having a because RCM cycle, I could see that a lot of companies have been implemented after the COVID. It's been a huge number of companies have been invested for the medical billing, since you know that only one business, only one process which runs during the COVID. It is only medical billing companies. To be honest, during the COVID time, all the industries and all the companies have shut down, right? Seriously, we didn't shut even single day. Even I got salary. I never, I would say, what I wanted to say that Even I didn't lose one day of my salary. I got my salary. But when I'm seeing the shops have been closed, but my account is fulfilled with my salaries. So because you know that right, after 2 months, we started billing the COVID vaccines. So it's a big industry. After the many industry have focused on it for how this industries work even during the COVID, because COVID is a things which have entirely changed everything, right? The person who are on the top, they are down. So it's been changed. The fate completely changed by the COVID. But seriously, I would say after seeing this industry, many investors have been invested in this medical industry. Now after a COVID, if you see the strategies, market strategy, you could see lot of company have been involved into this business, because it's never been stopped even one single day. So that is a magic for medical billing. So now you have to think, if you are good in communication, I would say you can go for account receivable. No, I'm bit of lagging in the communication, but I'm very much interested on KPO process. You can go, if people who are not interested to work in the night, but still I wanted to design my career. I wanted to be in the medical industry. As you can go with the demographic and charge entry and the payment posting. If you are having a background science, if you wanted to do a certification process, I wanted to earn more, I would suggest you can go on medical coding. So we have a different scopes and different perspective. So you knows it very well that what best thing will suit for you. So according to that, just choose the correct path, because this is the right time to choose your path. Because in one certain point where you are standing, that you have to take that accountability. You could not blame anyone, because the decision has been taken by yourself, right? So during when I was started this industry around 2008, during that time, so I have to produce my certificate, original certificate, to one of the company. I don't want to mention the company. So because they wanted to maintain the stability, so I have given my certificate, I would say. So during that time, I doesn't know that I'm gonna hand this much of amount on 2025. Seriously, I doesn't know what. But this is a good industry. So you got that opportunity. Luckily, the people who have been presented for today, you have to thank God. So because not everyone will be getting this opportunity, that will reach at the right time by the right person, to the right by the right person to the right person. So you are the right person. You are at the right time. Just take your think and take the decision. I would suggest you can check with your friends who have been working in this industry, because there is a lot of opportunities out there. Okay, I'm done. So shall we go with the questions? Do you have anything you wanted to check with me? Anything is fine for me. I can a little bit understand Telugu also, but not familiar. But I will be able to manage it. Yeah, tough. Great to know that you're 37 years old. I would like to know the age requirement for these positions. Age is just a numbers. But only one thing is, it depends on your commitment. I don't want to give you a fake commitment. So if you are not committed with anything else, that you because people always lay on the there depends on the commitment, right? If your commitment has not been set anything else, you can start from the scratch, but it will take time to reach to fulfill your commitment. For example, if you are committed with 25 to 30,000 per month, if you are going to start from the scratch, you will be considered as a fresher. Seriously, the market rate only will be provided. But trust me, within a 1 or 2 years experience, you will get it. So once you are having ample of experience, once you learn this entire thing, obviously that's all up to you. You can earn how much you want, but I'll ensure that stability is also the more predominant. Stick in a company, your in terms of salary, your growth will be less. But when you are in a position like a team leader, assistant manager, definitely you will be getting good salary. It will be a good package. But you have to groom yourself. Again, when it comes to designation, You have to good in your communication. You have to go good in your domain. So it's all up to you, because here we don't want to give you any fake commitment, but because it is not like a MLM, it is that opportunity we wanted you guys to grab it and utilize it. That's it. Any question from anyone apart from Altaf? Altaf, if you have still any question, you can you can raise your concern. And also your feedback and suggestion, I love to get it. Even if you can tell me if I'm going faster, if I'm not making it clear, if you have any doubt on any of the information updated in the slides, you can go ahead, because it is a kind of demo session. I cannot cover all the portions. So when you are into this when you are into this training part, when you are in a part of this training, obviously I will cover each and every department, how it works, what is needed. Then you will get a clear knowledge about this. Any question from anyone? Okay, Ram. Okay, then thank you everyone. Have a great rest of your day. See you soon.